through this next phase. For the CAG meeting schedule, based on where we are at the moment, we're going to go back to what was originally planned in terms of having a quarterly meeting schedule, but we'll still have CAG member feedback and input collected through both meetings as well as email and online surveys as we increase group communication with the neighborhood councils as well. In terms of the CAG subcommittees and participation on the steering committee, that is going to be on pause for the moment as we go into discussions with our county contracting and procurement group to make sure that we do and follow all the policies and procedures that are needed for doing both an RFP and the contracting process, which is our internal policies, the county policies that must be followed. So we'll pause that for the moment. I'm sure that we will come back at another point, after we get through that, in order to see what, if any additional subcommittees are needed to continue to move forward in the research proposals that are identified, and making sure the community is aware of what's being proposed and what's being done around that. But at the moment, we'll focus in on doing the internal meetings that are needed to follow the policies and procedures for both of these. As mentioned, for the CAG meetings, we want to try to make sure we get through a lot of what's identified from you and from us in the agenda, which will include updates on the study, having some guests that address any particular areas of focus or outstanding issues, subject matter experts on other topics, as well as other items of interest related to the study. We'll also ensure that there's an opportunity to pose questions to the team, as usual, and have a dedicated time for public comments during those meetings. We will try to follow the agenda closely to try to maintain orderly meetings. We can touch upon the items that we need to touch upon. Hopefully we can do that adequately. Some things are time sensitive, so we have to make sure that we can get the feedback we need and allow for individual voices to be heard respectfully during these meetings as well. Due to the demands of many of you might expect with COVID-19, Dr. Simon and I in particular, as well as many others in our leadership, are doing double duty, working on both the COVID-19 response as well as providing some input and oversight to the staff related to this. So they're just demands that are the reality that we live in, but we continue to do what we can. But sometimes we may be limited in terms of our participation in the CAG meetings. I do want to highlight some shifts in terms of public health staffing. Some of you may have seen some new names. I just want to highlight that Katie Butler started a new position in the beginning of this year, which is outside of the department, and will no longer be part of our project team. Katie's responsibilities will now be shared with other DPH staff, including Christine DeRosa, who many of you have gotten communication from, and Charlene Contreras. Christine will be working with Christina Vega on the community engagement component of the health study. And with over 10 years of experience in public health, Christine brings a wealth of experience and insight to our team and has worked closely on issues surrounding gas, oil, contaminants, and their impacts on the community. Charlene will support the project's leadership with overseeing the process around the study, getting the study solicitation together, and Dr. Simon will continue in his role as a SOC member. He will not be able to dedicate much time to community engagement as we did before, being a part of a lot of the meetings that we've had, again, just due to the demands presented by COVID. I do want to reassure everyone that your feedback is being heard and your concerns are being heard as well. And I want to touch upon a few issues that have been raised already and are being looked into and or addressed by our staff or this or trying to get information from others who have that. First, around existing environmental data, also known as the chemical list. The county is working on obtaining any outstanding environmental data related to the blowout and operations at the Aliso County storage facility. And we understand that the CAG has followed up with Supervisor Barger's office as well in January. And hopefully we get some better updates and news in relationship to that effort. But at this point, I don't have anything additional to share related to that. But it still is an ongoing effort. In terms of air monitoring, as part of the settlement with SoCal Gas, you all are aware of $3 million was devoted to setting up an enhanced air monitoring and incident reporting system in communities surrounding the facility. This effort is being led by the Aliso Fund Committee. It's not being led by DPH. And 2 public meetings have been held to inform the development of an RFP to solicit proposals from contractors who can implement an air monitoring and incident monitoring system that is responsive to the needs and concerns that have been raised by the community. We anticipate knowing more about this in the next couple of months, hopefully